Hi, good evening, everyone. So today we have with us Mr. Neeraj Lal. So let me first introduce Mr. Neeraj to you. So Mr. Neeraj comes with more than 2 decades of experience in the basically managing the healthcare businesses. And at present, he is the Chief Operating Officer at Apollo Hospitals, Ahmedabad, Gujarat region. Prior to this, he has served as Senior Vice President at Medicover Hospitals, Cluster Head at Rainbow Children's Hospital, and also as Group Chief Operating Officers at Sunshine Global Hospital. And so it gives me immense pleasure to tell you that uh, Mr. Neeraj has kindly agreed to represent our eminent board of basically industry advisory board for the MBA Hospital and Healthcare Management program that we are going to start in this academic year 2023. Thank you so much, Mr. Neeraj, for this kind getting agreed and looking forward to add value to this program with your huge experience in the healthcare industry. Thank you so much
Thank,
again.
thank you very much for having me on the board. And I think we working from the hospital side can able to contribute, and I'm sure in the near future we can have some good businessman in healthcare. We can change the landscape of healthcare with these kind of courses, and they make a difference in the patient care delivery system, especially post COVID. Thank you very much
Yes.
for having me on the board.
Yeah, that's what we are also aiming with this program at IIM Bodhgaya. Thank you so much again. So let me ask you a few questions, short ones. So I'll start with this very generic question, and it might be looking generic, but yes, the stalwart like you can give us a lot of information on this that can sway our brains and minds. So basically, now, as I said, you have got more than 20 years of experience in managing healthcare businesses. So based on your experiences and your outlook, can you just tell us something about the recent trends in the healthcare industry in India and how this industry is going to shape up in the future?
Okay, this is a very nice question. Actually, post-COVID, the healthcare ecosystem has dramatically changed. Any person, individual healthcare journey is broadly a series of event-based experiences, interaction, symptoms, ignoring symptoms, trying home remedies, delaying diagnosis, hospital-based fragment. But I think digital healthcare is an idea which has changed the entire scenario, not in India, across the world. See, you see it. We are witnessing two to 3 lakhs of telemedicine consultation every day. If you see pre-COVID, is it less than 45,000? Number one. Secondly, you are catering to a larger audience. Now, say I operate from Apollo Hospital, Ahmedabad. We have daily 800 OPD consultation, but around 600 to 650 consultation is happening on a virtual mode. We are not only connected to Gujarat, but close by state like MP, Rajasthan, Punjab, and at the same time, people from outside India, Dubai, Middle East, and non-resident Gujarati, which are staying away from Gujarat. So I think we are connected with the virtual world. And I think these days there is something terms in management we say flipped care. You know how much average time spent by a person on flipped care. So
Okay.
it has been seen a patient or a client spend only less than 5 hours entire year in seeing
Mhm.
the clinician, talking to the clinician one to one,
Okay.
and he spent 8,755 hours looking after themselves through a connected world, maybe a pharmacy, maybe a healthcare worker or a doctor. So rest of the waking hours he's spending on that. It means I think now healthcare is on the app. Say for example, we have a Apollo 24 by 7. So 24 by 7, your health record, your pharmacy, doctor consultation. So while you open Apollo 24 by 7, you say a pediatrician nearby, a cardiologist nearby. You see their slots, talk to consultation, consult a doctor, and you will get e-prescription. You get pharmacy at your doorstep. You got your pathology at your doorstep. So this entire thing is changing the entire landscape of healthcare. We have a concept known as EICU. Apollo Ahmedabad got around 100 ICU beds, but we are catering over 2000 ICU beds. Our dashboards, our ICUs is connected to all these people. So I think these have changed the way. I'll give you example of AI cameras. See, generally AI cameras is not used in the healthcare. We have experimented with the healthcare. We have installed on a pilot basis this AI cameras in our OPDs and in our areas where doctors and staff is coming, so I can check the happiness mood, the sadness mood, or any other mood of the patient. So look to this scenario: a patient is waiting in the OPD, waiting for the consultation of a doctor, and a emotion is captured by AI cameras, and a customer care manager see a cameras and go close to him or her. Hey patient, what is happening to you? He was quite surprised. How do you came to know? And then he say, I'm not I'm waiting for the last half an hour, I'm waiting for an appointment. So this is capturing the moods of the patient. An employee or a doctor entering to a hospital where a happiness index of 75% in the morning, while he's going out, his happiness index is gone down to 32%. He'll get a call from the HOD of that department or a HR head. Hey doc, what happened to you? Why you're not so happy? How can I make you happy? All those things. I think we are engaging more with the patient, we are engaging more with our staff and our doctors. So I think it is changing the way we work. You must be seeing in your city, you book a cab, Ola or Uber. They take you from one place to another place. We have an app inside the hospital for patient transport management.
Okay.
So we have a team of 10 people who are dedicated for patient transport. See, you require a transport from ICU to a OT to a ward to a different areas. So whichever the closest station, a staff nurse or a customer care executive, they check on app which is the closest patient transport team. They click on that and closest transport team go take a patient, drop him there. So you save the transport mechanism inside the hospital. So I think these are the few things which hospitals are doing, and I think we require people to manage this entire tech operation.
That's great to know. Basically, I can, like, after listening to your data points or views, can I say something like this? Healthcare is gradually moving from that we used to understand traditionally. It's more of a human touch, whereas it's moving towards more of human touch, but facilitated or aided by tech touch. So
Yes,
both human touch and tech touch coming together to
I think
deliver.
I think healthcare is moving away from the hospitals.
Okay, yes.
Hospitals are meant for ICUs, critical care, as well as operations or the procedures. But I think because if you see the COVID, everybody is struggling for a bed. They don't have beds. So I think we don't. If we see the gap between the healthcare and the number of population, so I think tech can solve this problem.
Great.
Yeah.
Yeah. So based on this, now the question that comes to my mind is, now see, traditionally when we think about management programs in India or abroad, we talk about functional domains like marketing, HR, operations, IT, everything, right? And industry has been complaining that management graduates are not well equipped enough to, like, not industry ready enough, right? That has been the complaint from the industry. Now, given that context and the way healthcare industry is fast changing with the adoption of technology, now, do you think that there is something, somewhere there is a need for professionals who are specifically trained on managing healthcare businesses? So, specifically the healthcare management education, which is like management education moving from generic stream to the industry specific streams and training on those industry specific areas. Do you think that there is a need for such kind of healthcare management program? And if at all, so which are the areas in which this healthcare management graduates can actually fit into?
No, I think like we see multi-specialty hospitals.
Mhm.
I think healthcare or hospital require a multi-specialty hospital managers. See, there's so many verticals in the hospital. We say SBU heads. Like I got managers in different department. I used to say either a department lead or a SBU manager. He or she is taking care of ICUs, operation theaters, diagnostics, then your operation means supply chain management and all. So so these kind of specificities are there, and then they gradually move to a business head role or a CO role or a CEO role. So I think these kind of managers, I think expectations not only from hospital, but I think healthcare is a big space. We require healthcare managers these days in management of insurance companies, number one. We require these people in the management of private equity. If you see for the last few years, I think many private equity is managing the hospital. They are not only parking their money, so they are looking for a hospital manager who understand healthcare, who know what is this hospital operation is all about. So if I as a private equity want to manage some hospital, I require certain hospital manager. So there's certain people on the board of private equities. Then the government of India, I think every state, I am happy to share that our Union Minister of Health got a team of health advisors, health manager. Like in Gujarat, the health minister got a team of hospital managers who are taking care of health portfolio. They advise on the healthcare program of the state. So it is a team which is taking care of mother and child segment, which is taking care of private hospital, which is taking care of medical educations, over and above healthcare consultancies now. See, if you see the IT part of it, the startup. Recently, I think we celebrate startup day. Startup day was there, yeah, yesterday. So there was a report. More than 60% people are putting up in the healthcare startup, more than 50%, if you can see. So where are the people which will come from? They are coming from the management schools. Like one of them is Indian Institute of Management Bodhgaya, which is they're planning to make the manager in that way. So I think that is very important. We are using drone for different thing. Why you are not using drone for transfer laboratory sample from outreach clinic to the hospitals? So I think remote patient monitoring is a key. There's so many areas ranging from healthcare IT, healthcare consultancy, insurance companies, equity business, quality managers. Quality is a big thing now.
Yes.
We are not talking about only NABH, but the specialties focus. We are generating a stroke standards now. There is a dialysis standard. There is
Mhm.
PICU, NICU standards. So I think, and a big chunk of public health. So I think the gap is there. I think somewhere we have to fill this gap through healthcare management.
Okay, thank you. Thank you so much for this great information, because this is much needed information. Why? Because people believe that when I'm going for such kind of program, I'm just stick to managing hospitals and the floors. That's they lack that broader overview of the complete healthcare industry, and that's what you have closed the loop by talking about the different aspects and the opportunities in the different domains of the healthcare. Thank you so much for this great information, piece of information.
Yeah.
Yeah. So since it's a short interaction, so I'll come to my last question to you. So since you are already on our board to guide us for this MBA Hospital and Healthcare Management program, so we would like to know your opinion about IIM Bodhgaya's this program, as well as what would be your message to the students or the candidates who are aspiring to build up their career in the domain of healthcare management.
Right. Thank you very much for having me on the board. Having said that, I think IIM in the country has make a dominance into the management of various multinationals, financial institution, and all. I think IIM Bodhgaya is foremost in the MBA in hospital and healthcare management. I think network of IIM is very important. Number one, I've seen the course module. It is fantastic. I think good good amount of subjects is taking care of the organization of clinical services, management services, the marketing part of it, the finance part of it. I think that is
Thank you.
very important, because I was very happy to see, because I used to go to few institute which teach hospital management, but this course is comprehensive. And I'm sure the
Thank you so
student
much.
will consume this course and apply this course. That is very important. And I think for me, the message to the students passing out is very important. I think technology and innovation is key to success. In order to bridge the gap between the patients, population, and healthcare, I think we have to think out of box. So the innovation is happening in most of the places. There is a saying, healthcare is thinking innovation like shipping industry, which is last. So I think we have to innovate, we have to think out of box, which will make a patient difference. So that is my message to the candidates. And thank you very much for having me on this platform. Good luck and all the very best.
Yeah. So thank you so much. So that means I would say to my up like coming incoming students that get ready to have some kind of classrooms where you will have open minded for innovations, and also get ready, make yourself ready that you may be a doctor, you might be a dentist, you may be a pharmacist also, but yes, now you are going to face some technology, right, in healthcare. So that's why you are going to upgrade yourself with the latest technologies that's going to happen in healthcare. And I'm sure that your guidance will make this experience of make this journey a wonderful experience for both like for the institute as well as the students, the participants of the program.
And I think the core thing in this module, I was seeing the spending time in the hospital. I think their on-site internship is key. I think
Yes.
when you shadow a hospital manager or a CEO of the hospital, you see healthcare on site, management of healthcare issues. So I think that is very important part, which is in this course, which will make a major difference in person passing out from IIM Bodhgaya this course.
Yeah, and that too, we have got that an extended one for 4 months.
Yes, I
That's
think it makes a difference.
normally, yes,
One
yeah,
month is the old thing. I think
yes.
4 months
Normally they
will make a
normally
difference.
go for, yeah. Normally people go for 2 months. We are going for just the double. It's four
It,
months.
it is something you are making a doctor without entering into the operation theater.
Okay, so thank you so much
Thank you very much.
for a nice interaction. Looking forward to such kind of an interactions more in future. Yeah,
Thank you very
thank
much.
you.
Thank you very much.
Yeah.